Which of the following best describes this placental abnormality? Placenta accreta, increta, percreta, previa, or vasoprevia? A 35-year-old woman at 36 weeks gestation presents with a routine prenatal visit. She has a history of 2 prior C-sections. Her ultrasound examination reveals an anterior placenta with evidence of invasion through the myometrium and into the bladder wall. Okay. So when I see 2 C-sections, that's a risk factor for placenta increta, procreta, and accreta. So I'm going to get rid of placenta previa and vasopressia.
Okay.
And then there's just definitions here. I believe that I think that the answer is going to end up being I actually don't remember 100%. Invasion into the myometrium. I think it's going to be through the myometrium, invasion through the myometrium. So I think of increta as into the myometrium, and percreta as in like penetrates through the myometrium is kind of I think how I remember it. So I'm gonna go with placenta percreta as
Okay.
my answer here, and that's my final answer.
Good. Bingo. All right, let's talk about this. I'm going to give you an easy way to remember here, some key takeaways here. Try to give you some key takeaways for every question here. So easiest way to remember, right? Placenta accreta and creta per creta. They're just increasing in severity. Just remember like that. And then
Okay.
it's in alpha order, AIP, right? So A
Yep.
is the least version, I is the middle, and P is the worst, right? And so you're thinking about, okay, a little bit attached, right, to the uterus. You think like very attached, right? Like almost full thickness, but not. And then percreta is full thickness through the myometrium into other things, right? Like for instance, the bladder or your colon or something out, but it's full thickness, right? And
Yeah.
so obviously, just so you know, clinically, right, for your future reference, right, the worse this is, the harder it is to deliver the placenta because it's so attached. You don't want to obviously deliver their uterus, right? And so these people you want to keep an eye on with ultrasound because you want to plan for, oh, if the placenta is ingrained into the uterus, then you could have like diffuse bleeding after pregnancy, right? Because your placenta needs to be delivered to stop that bleeding, and so a lot of these people might need like an emergent hysterectomy if
Mhm.
if it's so ingrained and you can't deliver the placenta. So things to think about.